Welcome back to this series on self-help acupressure. Today, I will not only be discussing the miracle of healing through the fingers and hand, but also touch upon how these acupuncture points may have diagnostic utility, especially for functioning of the heart, lungs, and large gut. In the previous session, you may have experienced the facial checkout points for rejuvenation and revitalization. To further energize the body meridians, one can work on the acupoints on the hands and feet, which are also easily accessible by oneself. The yin and yang paired meridians traveling in the upper and lower limbs communicate with each other at the fingertips and toes. At the wrist, where these channels cross, are three important acupuncture points on the dorsum and three important on the frontal or palmar aspect. Interestingly, these acupuncture points at the wrist, apart from the therapeutic value, they have a diagnostic utility also. So let's start off with massaging the 6 points at the level of the wrist. This can easily be done by applying the Chinese bangle, which energizes the heart, pericardium, lung, small intestine, triple warmer, and large intestine. This is applied by grasping the wrist and rotating it in a forward and backward motion. A minimum of 7 seconds are devoted at each wrist. Now, pinch the fingertips of the small finger, index finger, and ring fingers of both hands. Remember to spend 7 seconds during each pinch. There are 2 finger exercises to be followed. The first is to bend each finger at right angles to the palm of the hand and keep pressed for 7 seconds. The next finger exercise is by bending the finger at the first joint till it is parallel with the third phalanx, then releasing it with a snap. This maneuver permits the vital energy to accumulate by temporarily stopping flow, just as in stopping the flow of water by standing on a hose. Upon release, these energies flow better than ever. Three important points located on the meridians of the large intestine, heart, and lung respectively are depicted. These points can be stimulated by rotary motion or thumb thrust. If there is superficial tenderness on any point, use rotary motion in an anti-clockwise fashion to stimulate the channel. If there is deep tenderness, then use clockwise rotary motion to suppress the overactive channel. And if there is no tenderness, then thumb thrust will suffice. The large intestine 4 point is located on the midpoint of the web formed between the thumb and index finger, or if one approximates the thumb and index finger, the top of the bulge of the muscle would be the large intestine 4 point. At the junction of the 4th and 5th metacarpal lies the heart 8 point. It lies on the upper transverse crease of the palm. Palpate the belly of the thinner eminence. Then feel the first metacarpal bone. Midpoint of its palmar surface lies the lung 10 point. If a particular point is tender to gentle touching, it indicates deficiency in the organ or associated part. If the point is tender on deep pressure, it indicates overactivity of the organ. If there is no tenderness, it indicates good health.